listening to the Agent Survival Guide podcast, a podcast for today's insurance agents. Informing, educating, empowering, improving the way you do business in an industry that's anything but static. In today's episode, make sure your applications don't get flagged during the submissions process. Let the Agent Survival Guide team help you write cleaner insurance applications. 10 tips for submitting an error-free application, written by Chad Hauk, Jack Clark, Isabel Vitale, and Cassidy Potts. Anytime an application gets flagged during the submission process, it's a delay on your client's coverage and your commission. What if we told you we can help you avoid stalled applications? Throughout the year, Ritter Insurance Marketing processes thousands of enrollment applications for agents. To help you ensure your submissions pass through the system cleanly, we worked with Ritter's new business team to put together some tips for completing flawless applications. Before we get into the nitty-gritty, we'd like to mention an overarching suggestion. Move your applications online. Paper applications grow more obsolete as carriers perfect their online forms. FMOs like us create useful tools, and more people over 65 use the internet. In fact, about 53% of adults apply for Social Security online, which has increased roughly 10 to 12% over the last 10 years. We feel so enthusiastic about moving applications online. We have suggestions on how to do so at the end of each tip that we will mention here today. And spoiler alert, the tools we have here at Ritter Insurance Marketing make it so much easier. So, number 1 on the list, prepare thoroughly. Before you begin an application, make sure you have all the necessary client details gathered, like full name, date of birth, and Medicare beneficiary identifier all in one place. If you must navigate away from an online application or get up and grab something you forgot, you increase the risk of losing your spot or making a mistake. Put in place good processes for collecting the necessary data for an application, like utilizing a good customer relationship management or CRM system. Prepare online with Ritter's platform. Ritter Insurance Marketing's online platform makes it easy to store and access client information, which you can then use to quickly email or text FastTrack pre-filled MAPD or PDP applications to your clients for a digital signature. Number 2, write neatly and legibly. If you're completing a paper app, use a pen with blue or black ink and do your best to keep your handwriting easy to read. If there's any room for interpretation, Ritter or the carrier will end up circling back to confirm what you meant, which delays the process. If you can't read the application, it's likely we can't either. It never hurts to review the application with the client to ensure its accuracy before moving it through the submission process. You can keep it neat online. Now, it may be silly to state the obvious, but if you submit online applications, no one has to worry about reading your handwriting. Number 3, keep in compliance with SOA rules. CMS rules on scopes of appointment, SOAs for short, dictate that agents must complete an SOA 48 hours before making an appointment with a beneficiary. Exceptions to this rule include 1, when a beneficiary is 4 days or less from the end of a valid enrollment period, so the annual enrollment period, the open enrollment period, a special enrollment period, and their initial coverage election period. And then 2, unscheduled in-person meetings or walk-ins initiated by the beneficiary. The scope of appointment is also only valid for 12 months, and then you will need to get a new scope if the original expired. We recommend tracking the start and stop dates of your scopes within your CRM. Also, please note, you cannot complete SOAs for AEP before October 1st. On the scope of appointment itself, make sure that at least one of the selected types of contracts to be discussed on the SOA matches the plan that's chosen on the application. Additionally, make sure that each field is filled out in its entirety and is legible if you're filling out a paper SOA. If during your meeting you and the client decide you'd like to discuss additional plan types, simply fill out another scope of appointment. The SOA is a good point of reference for agents to easily access clients' contact information in the future. Even if certain fields are optional on the SOA, it's likely in your best interest to make sure everything is filled out anyway. SOAs must be kept on file for 10 years per CMS rules, regardless of if a sale occurred or not. Keep in mind, even as CMS rules change, some carriers may maintain their current policies. You are still responsible for following the procedures of the carriers you represent. Collect scopes of appointment online with Shop and Enroll. Using our simple CMS-compliant platform, Shop and Enroll, means you can collect and store SOAs digitally. When you register for Shop and Enroll, you'll receive a free website branded with your information where clients can fill out eScopes, browse plans, and even enroll in Medicare Advantage or prescription drug plans. You can also send eScopes to clients for a signature via email or text. Shop and Enroll works in tandem with the Ritter Platform, so any signed eScopes will be stored under the eScopes tab in your client's profile. That is one more way that we make your job easier. Number 4, provide details where required. If an applicant answers yes to any health question that requires additional information, be sure it's provided on the application. Additionally, if a special enrollment period requires any extra information, for example, a chosen primary care physician or PCP, Medicaid, PDP, or extra help info, it must be on the application. Store details in your client's profile. On top of basic information, you can store a myriad of client details in the Ritter Platform: conditions, providers, preferred pharmacies, and prescriptions. For additional information, like whether your client qualifies for extra help, use the Ritter Platform's Notes feature. You can upload attachments directly from your computer if you've recorded the information digitally, or scan paper forms into your computer if you've handwritten the information and then upload. If you don't have a scanner, try using an app on your phone like Adobe Scan or Microsoft Lens, which turns pictures from your phone into PDFs. Then you can email or AirDrop the PDF to yourself, save it on your computer, and upload it to the Ritter Platform. And if you don't have a scanner app on your phone, we have an Agent Apps episode about those apps if you want to give that a listen and try them out. That will be in the episode notes for you, as well as instructions on how to use the Notes feature inside the Ritter Platform.
As you can tell, the journey from handwritten form to digital version is a bit cumbersome. So that's why we recommend starting with a computer from the get-go. You can record your client's information directly into the Ritter platform, and you can cut out some of those middle steps. When you go to fill out an application, you'll have all the details you need stored in one place, your client's profile on the platform. You can cut down even more steps when you utilize Shop and Enroll's pre-filled FastTrack application feature, which you can use even for those without that shared client record. All you need to do is select your client and a quoted plan through the Clients tab in the platform and send the application link their way. They will open and complete the application with their date of birth, last name, and Medicare beneficiary identifier. It really is as simple as that. Number 5, select a PCP when necessary. If an applicant would like a carrier to auto-assign a primary care physician or PCP, be sure to note that in the appropriate field. Some plans require a PCP selection, so leaving this field blank could hold up an application's approval. Typically, applications for HMO plans require the applicant to specify an in-network PCP. Check to make sure an in-network PCP is on any application for an HMO plan to prevent roadblocks in the enrollment process. As with most application information, it's always better to have more information rather than not enough. Therefore, if your client can list that primary care physician, request that they do so regardless of the requirement. Now, let's talk about copy and paste, a feature on the Ritter platform. As we just mentioned, Ritter's platform organizes all your client information and pre-fills much of the client's information into a FastTrack app. But not everything will pre-fill, like the primary care physician. So don't forget the power of copy and paste. Pull up one web browser window with your client's profile, and then pull up another with the application. Now you can easily copy information like the PCP and more from your client's file into the application without having to retype everything and without increasing the chances of mistakes. To start, highlight the PCP by clicking at the start of their name and dragging your mouse to the end of it. Next, either use the shortcut Control-C on your keyboard to copy, or right-click on your mouse and select Copy. Then click where you need to paste the PCP and either use the shortcut Control-V to paste, or right-click again with your mouse and select Paste. Alternatively, leave it blank and request that the client fill in this information after you send the pre-filled app. Number 6. Match the attestation with the election period. The selected period in the attestation of eligibility section needs to align with the selection of IEP, AEP, or SEP in the agent/office use section of the application. If the election period requires a date, such as the date a client is losing coverage, make sure it's present and accurate. Additionally, if the SEP requires any extra information, such as Medicaid, PDP, or extra help information, it must be on the application. If you need clarification for which period to select, you can ask your Ritter sales specialist. We will have the contact information for you in the notes. Moving on, what about validated election periods? We've created a fail-safe, so you can't move forward in an online application until the attestation of eligibility matches the election period. When enrolling clients using Shop and Enroll, if you select I have a special circumstance and a type of CMS-approved SEP, then the site will validate the dates you enter. This simply means that the site will flag your application and not let you proceed until the dates you enter match the SEP you've selected. Let's move on now to number 7. Never alter a client's signature. Even though you may have the best of intentions, altering a client's signature or the associated date on any application is strictly prohibited. This rule extends to the scope of appointment or any other documents that go with the application as well, and even your own signature or date as the agent. It's always better to start a new application with your client or to apply late than to forge and falsify a legal document. Let's talk a little bit about digital signatures. Emailing or texting a pre-filled FastTrack application to a client provides a safeguard against signature alteration. The client controls when the application is signed, and nobody can alter it after the client signs. The app is automatically submitted to Ritter for processing with the carrier. Number 8, make sure the application is complete. Every part of the application is important to us, the carrier, and your client, so it's vital you make sure the application is complete. Check and double check to make sure you finished the application before submitting. This may seem like a simple tip, but you might be surprised what errors you find on the second check or even the third check. Another handy feature of Shop and Enroll, it flags omissions. As a Ritter agent, you can reduce your chances of missing information by using Shop and Enroll for Medicare Advantage and prescription drug plan enrollments. The site automatically flags errors on the application. Our new business department is also on standby to answer any questions you have about the process and provide quality analysis once we have the application for any carriers we process. We make sure each application is complete before sending it on to the carrier. Number 9, submit the application on time. Once you've taken the time to review the application, be sure to submit it with the appropriate cover sheet and any other required documents within the specified time period. Applications must be submitted to Ritter within 24 hours so that they can arrive at the carrier no later than 48 hours from the agent's signature date. If you're late, you risk being penalized by the carrier. Plus, why hold things up? A delayed enrollment is a delayed commission. To help you stay organized, you can assign yourself tasks on the Ritter platform. Let's talk about this for a second. When you begin an application through Shop and Enroll, you have the option to save and exit the app. You can then access any incomplete apps from the Submissions tab. Signing the app will always be the last step. Once your client digitally signs the app, either in person during an appointment or virtually via email or text, and pushes submit, the app immediately goes to our new biz department for review. So you don't have to worry about that 24-hour time period that plagues paper apps. Letting incomplete apps sit in your Submissions tab isn't a great idea, though. So we recommend finishing an application in one sitting to submit directly to Ritter if your client is with you, or to send off to your client for review and signature if your client is not with you. If you do have to save and exit the app for whatever reason, assign yourself a task in the platform reminding you to come back and complete it. It's as easy as clicking the bell icon in the upper left corner of a client's profile to assign yourself that task. Another tip, set a reminder on your phone as well. I live by alarm clock reminders on my phone. There are a lot of things I wouldn't be able to remember without those reminders. Number 10, our final tip, when in doubt, call for help. Your business is serving your clients, and our business is serving you. If you have any questions about submitting an application, don't hesitate to call Ritter for assistance. Besides calling us for help, you can always submit a question or request by clicking the ticket icon in the upper right-hand corner of the platform's agent dashboard. If you're tired of completing scopes of appointment and enrollment applications by hand, I would suggest checking out Shop and Enroll because it offers digital solutions with compliant eScopes, FastTrack pre-filled applications, and online enrollment options for more than 30 major carriers. Best of all, agents registered with Ritter Insurance Marketing can get a Shop and Enroll site for free, and we have more information about Shop and Enroll in our notes. That's actually where you'll find all of the resources we mentioned here in today's episode. Thank you so much for listening. We will see you next episode. This episode was written by Chad Hauk, Jack Clark, Isabel Vitale, and Cassidy Potts. Script proofing by Tina Lamoureux. Recording and production by me, Sarah Ruppel. Podcast design by Urban Rivera. Artwork by Vivian Zhao. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an Integrity company.